Hello and welcome to another installment with me, Alicia. In the United States, more than 5 million women are living with endometriosis today. In fact, it's estimated that 35% of infertile women have endometriosis, which makes it difficult, if not impossible, to get pregnant. On this video, we're going to discuss what endometriosis is, what causes it, and how it affects fertility. Endometriosis is a non-cancerous opening disorder that often leads to infertility. A common block to conception, a lot of women may not realize that they have endometriosis until they try it for months to conceive and cannot get pregnant. Endometriosis occurs when endometrial tissue, which normally lines the uterus, is found elsewhere in the body or outside the endometrial cavity for reasons which are not yet understood. This tissue starts to act just like normal uterine tissue, and during menstruation, the tissue starts to bleed and break down. As this happens, scar tissue starts to form, usually in the pelvic region. The scar tissue can then lead to potential problem with endometriosis and infertility. In women with endometriosis, the displaced tissues function and are influenced by hormones just as normal endometrium would. This means that these displaced tissues build up as the body approaches ovulation, then begin to break down when ovulation does not occur and also bleeds during menstruation. When the endometrial lesions bleed, the blood accumulates locally and triggers inflammation and pain. Over time, this may cause development of internal scar tissues or adhesions. Endometriosis may attach to the ovaries, fallopian tubes, bowel, bladder, ligaments, or other areas in the abdominal cavity. In the lesion developed, this may cause internal organs to become stuck to other internal parts of the body and may even cause displacement of organs and other tissues. Some of the symptoms include heavy menstruation with pain and abnormal length of cycles, lower abdominal pain, back pain, and burning pain, frequent or constant pain all month long, painful sexual intercourse, painful during bowel movement or urination, ovarian and abdomen swelling, and finally infertility. Endometriosis can have a huge impact on fertility, being blamed for 35 to 50% of fertility issues in women. Endometriosis is an estrogen-dominant condition. When there is too much estrogen in the system, it causes hormonal imbalance. Proper hormonal balance is essential for healthy fertility. Endometriosis also creates a situation of congestions when there are excess tissues growing in the uterus as well as other areas of the body, which make it harder for an embryo to attach and grow healthy. Every month, the excess tissue bleeds, which causes inflammation to occur and scar tissues to begin adhering to uterus, fallopian tubes, the ovaries, and other organs. This causes some serious congestions. If endometrial cells attach to the ovaries or fallopian tubes, this may alter normal ovulatory function or cause the fallopian tubes to become blocked. As if there wasn't enough, some research suggests that the woman's body may form antibodies against the misplaced endometrial tissue. The same antibodies may attack the uterine lining and cause miscarriage, up to 3 times the normal rate. If endometriosis is left untreated, this condition has serious negative impact on reproductive health. There are both medical options and natural therapies to help heal the body from endometriosis. Endometriosis is usually diagnosed by laparoscopic surgery. In the case of surgery, doctors will often suggest laparoscopic or abdominal surgery to remove the endometrial lesion, scar tissue damaged areas, and clip away adhesions if possible. In the case of severe endometriosis, a doctor may suggest a full hysterectomy, removal of uterus, cervix, ovaries, and fallopian tubes. The purpose of hormonal and pain medication is to stop the menstrual cycle to prevent further growth of the endometrial tissue. This may also help to reduce pain. If pain is still present, they may prescribe pain medication. Hormonal medication alter the natural menstrual cycle and may prevent pregnancies. They all come with a variety of side effects. Apart from the medical options we've just discussed before, there are some natural approaches to treating endometriosis that you can use if you're living with endometriosis. Lifestyle change are some of the most effective ways to help deal with endometriosis naturally. This would be changing your diet, clearing out old tissues and congestions, balancing your hormones, and avoiding certain pollutions. The overall goal is to support proper functions and health of endometrium, endocrine, and immune system. That's it for this installment. Be sure to join us again for more info and tips. This is Alicia signing off. Please leave a comment, rate my video, and don't forget to hit that subscribe button. Bye now!